Dennis Lopez from the International Organization for Migration, and welcome to the Migration Health Research Podcast. The current issue of the Migration Health Research Bulletin number 31 features publications focusing on the migration health landscape in Southeast Asia and the Middle East. For our audio podcast episode, we spoke with Dr. Patrick Duigan, Regional Migration Health Advisor in IOM Regional Office in Bangkok, on the overview of the status of migrant health among the ASEAN member states, outlining the efforts and initiatives on migration and health in ASEAN. Let's listen to Dr. Patrick.
This document was a collaboration between IOM and the ASEAN health sector. So ASEAN being the Association of Southeast Asian Nations, made up of 10 countries in Southeast Asia. And as part of ASEAN, there's different work programs, and one of those work programs is under the health sector, on strengthening health systems and access to care. So under the sort of development agenda of ASEAN, they have specific priority areas for collaboration where the ASEAN member states will collaborate together. And one of the key areas that they see is important is to look at the issue of migrant health. And as we know, it's not really possible to know what to do about migrant health if we don't understand what the current situation already is, of where are we in terms of the status of migrants' health, where are we in terms of some of the indicators regarding health access, but also looking at some of the policy and legal frameworks around migrants' health. So noting that ASEAN wanted to embark on some endeavours to improve the situation of migrant health, it was early on recognised that they needed to sort of take stock of what was happening in each of the 10 countries within ASEAN regards to migrant health, what was some of the status of migrant health, what were some of the policy initiatives, and how did those policies, frameworks and interventions compare amongst the different ASEAN countries. And it's an interesting grouping of countries because there are primarily migrant-sending countries, such as the Philippines. There are primarily migrant-receiving countries, such as Singapore. There's transit countries as well. So there's a mix of different countries in the ASEAN grouping. And it was really important to look at what is the current status of migrant health amongst those countries. And so the main purpose of this report was to work with the member states and IOM and the ASEAN health sector personnel to undertake a review of what the status is, what the different laws and policies are regarding migrant health, any indicators, any migrant health information systems, any financing mechanisms for migrant health, to really have a baseline understanding of what the situation is amongst the countries. And the second purpose of this document is also to, through this research and through finding out the information and through the discussions of the individual countries as well as some of the multi-country discussions as part of the ASEAN health sector working groups, is to look at developing an ASEAN framework on health coverage for migrants. Not only looking at what the current situation is, but out of that evidence start working towards an evidence-based framework for ASEAN to develop improved health coverage and access for migrants across the region as well. It was an interesting exercise in terms of having to coordinate with 10 different member states, with 10 very different health systems, with 10 very different scales of economies and development status, 10 very different migration patterns, as I mentioned, some primarily migrant-sending countries, some migrant-receiving countries, some huge countries, like Indonesia with 350 million people, and some very small countries like Laos with less than 10 million. So an interesting exercise. Took quite a long time to get the information from these 10 countries, to follow up with the Ministries of Health and the focal points, also dealing with personnel changes, to collect all that information. And then the other challenge that we had was, once the information had been collected and analysed, the process with working with ASEAN is that the information goes back then to the member states for their review and approval. And because it took us such a long time to get the information in the first place, by the time the reviews went out and were looked at by the relevant focal points, some of the information perhaps was out of date or needed to be updated. And so one member state wanted to update their information, and then the other 9 decided they wanted to. So it actually took quite a long time, a number of years, to get everyone to be updated at the same time with the same information and agree that what inputs they would have. We actually had to institute a cut-off date to say we're only accepting information as of this date, not as of the current day, because, as we know, it could take many months to get responses sometimes, and then it could start another cycle of information collection. And through that process, we were able to have very good collaboration with the different countries. IOM country officers helped to support some of the data collection exercises as well in countries where we have migrant health programming. And the secondary benefit was working to develop this migrant health framework for ASEAN, which was a key achievement of the process as well.
The process that you just described sounds really massive and impressive. So congratulations on this piece of work that you were able to produce in the region. Based on the case study, as you said, you went through a lot of back and forth and really confirming the results of the study. Can you share with us the results or the key findings from this case study? I know it's a lot to delve into the 10 countries, but maybe just zero in on the regional key highlights.
The study in itself is really to collect a situational analysis of the current status of migrant health in each of the countries. One of the key findings in that, there's 10 different countries with 10 different migration situations, 10 different health situations, 10 different economies. And so a lot of difference in the situation, findings and policies between the countries, but the similarities that are there are being within the ASEAN community, working towards regional integration, having common goals for reaching universal health coverage, and common goals towards increasing connectivity amongst each other, and a recognition that the goal is to ensure that all ASEAN citizens have access to healthcare, regardless of their migration status or where they are within ASEAN as well. The findings, I guess, were different situations in different countries. Some very good practices are identified in terms of examples such as migrant health insurance, whether that be in a receiving country such as Thailand, which has a good range of healthcare insurance options provided by the governments, or, for example, from the Philippines, that has PhilHealth, which provides coverage for migrant workers and their families left behind, but when the workers are overseas. So that was some good examples that other countries are starting to look at now. There was also some good findings in terms of the status of migrant health coordination mechanisms in the countries. So again, some good examples where there is good multi-sectoral migrant health coordination. So in Vietnam and Cambodia are some examples where there was established migrant health working groups at the national level, where in other countries such as Brunei and Indonesia, there's no formal mechanism for that migrant health coordination. So I think it was a useful exercise for the individual countries to then be able to look at what's happening in other countries for some good examples and identify some gaps where maybe they could improve. The other key sort of finding is that there was a need to develop this regional migrant health framework, noting that because there are so many differences, the goals are to work towards common access, common accessibility and common connectivity, that the development of the regional framework for migrant health was a key outcome and achievement, and it's based on the findings of the study. So taking the 10 different country inputs and looking what is common, what are the common gaps, what are some of the good practices, and what are some of the challenges, and how can that work towards improving migrant health overall. And so that framework really looks at 4 key areas, 4 key pillars to be able to work towards this new regional framework. The 4 strategic priorities of the framework, looking at improving health governance. So that is the recommendation, and this has been endorsed now by the senior officials as well as the health ministers of ASEAN. So look at health governance to support regional cooperation mechanisms to address migrant health concerns. And the second strategic priority is to address health service delivery, looking at accessible, affordable and quality health services in all ASEAN member states. And the third priority is to look at health financing, increasing financial risk protection mechanisms for migrants, whether that be through health insurance or social protection mechanisms. And then finally, looking at health information systems in supporting the enhancement and management of migrant health informed by scientific evidence. And the overall, their mission statement is to ensure that health coverage and access to essential health services for documented migrants across ASEAN member states.
As you have mentioned, there was a regional migrant health framework that was part of the results of this publication. So from that, and maybe I'm going to a larger question. So has that framework been adopted by the 10 member states, or do you see some results being translated into policies or programs already at this point?
Yes, we're very happy to note that after the many, many years of developing this research, case studies and going through the approval and endorsement process and review and checking, and the development of the framework also took quite some time through multiple technical working meetings, coordination between the countries. This framework has now been adopted by the 10 member states at the health ministers level, and so this is an excellent example of where research and evidence leads to policy in the real world. Now that we have this framework, the next step that is going to be taken is for an action plan to be developed, because at the moment this is a framework that has priorities and principles, so it talks about what the goals are, what the guiding principles are in terms of the strategic priorities for what ASEAN would like to work towards in terms of migrant health, but it's more of a where we want to get to, but not how we're going to get there. So the next step that will be undertaken with ASEAN under the leadership of Philippines as well as Indonesia is to develop an action plan on implementing this framework. So this will go through another series of meetings and consultations with ASEAN member states and their focal points, as well as supported by IOM and hopefully other health partners as well, to look at these strategic priorities and say, okay, how are we going to reach these? What needs to be done from a practical level, both at the regional level at ASEAN as well as within each country, to work towards reaching and achieving these strategic priorities. So we hope later this year or early next year that there'll be the first consultations regarding developing this action plan, and that will probably, again, take some time to ensure that there's buy-in from all of the member states, that it's based on the realities in the countries, and it's something that is achievable, and then that can help to mobilize resources as well as action, as I said, at the regional level and at the national level to implement this plan and work towards the goals set out both in the framework as well as the GCM and WHO Global Action Plan to improve the health of migrants overall.
Thank you very much, Dr. Patrick, and thank you all for listening. Please feel free to share feedback with us. See you on the next podcast.